What we are seeing now is a lot more short stays. So even if there are increased admissions, what we are seeing are less severe cases and preemptive admissions, and also shorter duration of stay. So what we are anticipating for the Omicron wave are short stays at hospitals should they be required. What is important now is that we have a clinical care pathway for those who are most vulnerable. So for elderly people, those with serious comorbidities, and those who are immunocompromised, we have developed a clinical care pathway to ensure that if they are COVID positive, that we can treat the COVID, the infection in a way that ensures that the severity is much less compared to the cases last year. So we will continue to monitor the cases, and should there be a change as far as the severity is concerned, of course Kementerian Kesihatan Malaysia akan memaklumkan kepada orang ramai. But so far we are seeing that the rise in cases is not reflected in severity so far, and that tracks with other experiences of Omicron. I have the director of Hospital KL, she's nodding away, so I take it that that's true. Jadi kita telah pun menggunakan beberapa bulan tempoh waktu di mana kes terkawal untuk memastikan satu admissions pathway kita adalah lebih tersusun, teratur dari segi katil hospital, availability of beds, availability of oxygenated beds, and also ICU. Kita telah mengambil masa yang di mana kes terkawal ini untuk membina kapasiti dari segi modular ICU kita di hospital-hospital besar. So we've added ICU capacity. Kita lebih yakin dari segi decanting pathway. Jadi kalau sekiranya berlaku surge dari segi kemasukan ke hospital, kita dah ada sistem sama dengan hospital swasta untuk kita hantar kes-kes bukan COVID kepada hospital swasta. Decanting ini adalah pengajaran ataupun lessons yang kita telah belajar semenjak Greater Klang Valley Task Force yang kita wujudkan pada bulan Ogos yang lepas. Dan yang penting juga adalah kita sedang melihat kepada clinical care pathway for the high risk group. So we are now going to get the antiviral medicine. We are looking at Paxlovid, the one that is produced by Pfizer, because once we have the antiviral medicine, ini dapat membantu rawatan. This is for treatment, this is for therapeutics. So once we get Paxlovid, I think we've looked at all the available antivirals. We'll buy a basket of antivirals, but I think most of it will be Paxlovid. We like the data coming from Paxlovid. Then it will be part of the clinical care pathway, so that anybody who ends up becoming sick from COVID that requires hospital care will be given the antiviral therapeutics to manage. And I think dengan itu kita memberi keyakinan kepada orang ramai. Most of us who get COVID eventually will either have no symptoms or home care, home isolation. Those who end up getting COVID with a little bit more severe symptoms will be cared for with the best antiviral therapeutics that we will give at the either primary care healthcare level or the hospital level. Yeah, for the cases, we have we obviously in Kementerian Kesihatan kita ada there's a lag in terms of the reporting, so we are aware of the numbers in the days to come. I can tell you for certain that the numbers will go up. Ya, kita dah tahu that the numbers will go up. But apa yang saya nak tekankan adalah dari segi keseriusan kes ini masih lagi keseriusan yang agak rendah. 99% adalah category 1 and 2. So don't look at the numbers now. It will definitely go up. Yeah, I've mentioned this many times. Saya tak tahu macam mana lagi nak sebut perkara ni, but the numbers will go up. Don't be scared. It is going to rise. Perhaps even sharply. Then we have to be ready for that, ya, dengan semua langkah-langkah yang telah pun kita ambil tadi.